porte sur la nature et la santé. Il s'agit du programme PaRx et pour cela, nous avons deux invités spéciaux. On a le docteur Melissa Lem de l'Université de la Colombie-Britannique et une étudiante en médecine de l'Université de Manitoba qui travaille aussi avec elle. Donc, je passe la parole à docteur Melissa Lem et Angela Woodbury.
Merci, Sadia. I'm really happy to be here today. Thank you so much for inviting us to present. So let's just get started. I'm going to share my screen here. Oops, I can't share my screen. There we go. Okay. All right. So I am Director of Park Prescriptions for the BC Park Foundation, and we launched our operations in November 2020 and have spent the last just over the year or so spreading out across Canada. And I just want to talk to you a bit about our initiative, about the health benefits of nature, and how health practitioners can apply our work to their own practices. So I want to start by asking everyone to think, maybe say out loud or actually put in the chat in one word, describe how you feel when you're outside in nature. I'll just give everyone a moment to do that if you want to share. I'm seeing a lot of peaceful, relaxed, grateful, real. And so often at the beginning of these presentations, we'll ask people to share their words, and similar words come up every time, not surprisingly, because this is almost like a universal feeling that we get when we spend time in nature. We feel calm, grounded, relaxed, re-energized, happy, present. And the amazing thing about it is, I mean, you may be aware of this by now, but there's actually this massive body of evidence behind the health benefits of nature. So it's not just its intuitive sense, which is important, but also science-backed. So these are just a couple of different infographics that I've been given permission to share over the last couple of years that I've been doing, or last decade that I've been doing presentations like this. The one on the left is from the Canadian Mental Health Association, and the one on the right is from a group in the US, and you can see from chronic diseases like diabetes, heart disease, and high blood pressure, to mental health conditions like depression, anxiety, and symptoms of ADHD in kids, even in terms of pain outcomes in hospital after operations, to work satisfaction. Spending time in and around nature has a wealth of different benefits for our physical and mental health. And so, as a physician, as someone who, did human biology when I was an undergrad, I often think to myself, like, what are the mechanisms behind why we feel so good when we spend time in nature? And there are two major theories as to why nature is so good for our brains. And the first one is called attention restoration theory. So when we spend time in busy cities, busy urban environments, they often have lots of traffic, lights, hard edges, crowds, sounds, different things that our brains have to constantly focus our attention on to navigate around and move around our cities. And what this does is it tires out our powers of conscious attention and increases fatigue and irritability. Whereas when you spend time in nature, it's actually a source of soft fascination. So it's interesting, but it doesn't require us to constantly direct our attention to move around and to make our way through these obstacles. And so what that does is it restores our powers of attention and it reduces that fatigue and irritability. The second theory about why nature is so good for our brains is called stress reduction theory. So essentially when we spend time in stressful environments or experience stressful situations, being in nature both buffers that and also improves our recovery and improves our resilience when recovering from stresses. And so there's also a theory around phytoncides, not even in theory, actually, it's been researched. So these are volatile organic chemicals that plants and trees release. And so if you imagine the smell of a pine forest or a cedar forest, when you step in, that's the smell of these positive plant chemicals. And there's research that's been shown that breathing in phytoncides can actually increase your natural killer cell activity. So these are immune cells, white blood cells that fight off viruses and bacteria, and also increase the concentration and activity of immunoproteins. So from your brain to your nose, to your body, nature is really good for us in so many ways. And so I'm just going to share a couple of different of my favorite studies that have to do with nature and health. And this is one that happened in Canada, right in Toronto. And what they did was they shared they analyzed high resolution satellite imagery, individual tree data, and Ontario Health Study data and self-reports of health perception. And what they found after controlling for a variety of different socioeconomic factors and environmental factors was that 10 more trees per block actually improved people's health perception, similar to an increase in their personal income of $10,000 per year, moving to a neighborhood with $10,000 per year higher median income, or being 7 years younger. So, in medicine, we know, and in healthcare in general, we know that both income and health are major factors in how healthy we are. So I thought it was, income and age are major factors in how healthy we are. So I thought this was a neat study because it really brought down kind of tree cover, something very concrete, and measured it against these, perceived increases in income and age. So anyway, a neat kind of concrete study. I like this study because it really, in a very specific way, speaks to nature time as medicine. So this was a study on 17 kids with ADHD, and they guided them on 3 different 20-minute walks through a city park, a downtown area, and a residential area. And what they found was that this 20-minute walk in the park actually improved their digit span backwards performance. So this is an easy test where you recite a number of numbers in a row, and then you ask the participant to recite them backwards to you. And the more you can recite, the better your memory and attention. And so this improved their DSP performance, similar to levels in kids without ADHD, and actually rivaled the peak effects of prescription stimulant medication like Ritalin. So as you can see in this chart over here on the right-hand side, this park walk actually had a significantly better impact on their DSP scores than the neighborhood and downtown walk. So it was something obviously, different from just the exercise and being outside in general that had a positive effect on their brain function. So no one is saying that, spending time outside is going to replace everything that stimulant medication does, but I think it speaks to how powerful nature can be as an adjunct to our traditional kind of medical treatments. And also, as a healthcare professional, I wonder, like, what dose do I prescribe when I'm prescribing nature? I have this program, but I have to make a recommendation. And so the next 2 studies form the basis of our recommendations in our program, that you spend at least 2 hours in nature each week and at least 20 minutes each time. So this was a study of almost 20,000 adults in England. And again, after controlling for a number of factors, what they found was that the likelihood of reporting good health or high well-being was significantly greater when their nature contact reached greater than or equal to 120 minutes per week. And these positive associations continue to increase and then peaked between about 200 to 300 minutes per week. So that's why we have that 2 hour minimum recommendation. And I think it's also conveniently a really easy number for people to remember. Our physical activity guidelines recommend at least 2.5 hours of moderate to vigorous physical activity. And so we say, why not spend, at least 2 hours of that outdoors or more? So we have that 2 hour recommendation. And this study formed the basis of our recommendation that you spend at least 20 minutes in nature each time. So both of these very conveniently came out in 2019, right when we were developing the program. And so this one asked 36 urban dwellers over 8 weeks to have a nature experience in an outdoor place that brought them a sense of contact with nature at least 3 times per week and for 10 minutes or more. And what they found was that their cortisol, or primary stress hormone levels, dropped over 20% more after a nature experience compared to a non-nature experience. And the efficiency of that cortisol drop was greatest between 20 to 30 minutes. So again, if you look at this graphic on the right here, you can see this third kind of discontinuous line is that 20 to 30 minute mark. So this is why we say, if you want the biggest bang for your buck in terms of your mental health, try to hit at least 20 to 30 minutes. Of course, more it doesn't hurt, but try to aim for 20 minutes. And then some people often wonder, like, why does the BC Parks Foundation, who is, the host organization behind this initiative, they focus on conservation and parks? Like, why are they kind of moving into this nature and health message? And the reason is because health is actually a really effective message at getting people to support policy change. And we can take some of these lessons from climate change research. So this was a study that came out just last year, and they conducted surveys with over 7,500 participants from 5 different countries around the world. And they asked the study subjects to read 5 pairs of statements and ask them which would make them more likely to support policies tackling climate change. So these range from the economy to the environment to health. migration. And what they found was actually that health and environmental framing increased people's support for these proposed policy changes. Economic framing actually had no effect. And if you think about, what we often hear from government and in the media about the, the cost to the economy or benefits to the economy of certain measures, to the average person, that didn't matter that much. And also opportunity or positive framing increased support for these proposed policy changes greater than negative framing. And also focusing on present impacts were more motivating than future impacts. So what we can take from this, and what we've done a lot in our program, is that focusing on current health impacts and opportunities in public policy messaging is more motivating to change behavior than the economy and other things. Even though they are important, it's not going to move the most people. And so, I'm president-elect of the Canadian Association of Physicians for the Environment, in addition to being director of PaRx prescriptions. And I think because of this and because of the information that's constantly coming at me from both sides, I bring a really strong awareness of climate change to my work on this that's perhaps missing from some other PaRx prescription initiatives. And the reason why I spent so much energy on this is because really connecting people to nature is good for the planet. So we know that healthcare is a major contributor to global carbon dioxide emissions. It's been said and calculated that if global healthcare were a country, it would be the 5th highest emitter in the world. And we know from what I've presented and other research that having more green space in our environments, connecting people to green space improves health outcomes, and therefore will reduce the burden on the healthcare system and our carbon emissions. Urban nature makes cities healthier in so many ways, from trees reducing and green space reducing the urban heat island effect to reducing flooding. And also children who have more nature experiences are more likely to become adult environmentalists, and adults who are more connected to nature are more likely to protect it. So the interesting thing is people who are more connected to nature not only want to conserve what they love, but they also tend to engage in more pro-environmental behaviors beyond that, like conserving energy, like recycling, like advocating for climate action. So I like to think that every time one of my colleagues writes a prescription for nature, that they're also doing something for the planet at the same time. Inger Anderson, the executive director of the UN Environment Program, has said that nature is one of the most effective ways of combating climate change and should be part of every country's climate strategy. So it's been estimated that if we fully embrace nature-based solutions for climate change, which focus on restoring and expanding and protecting nature while dealing with societal issues at the same time, this could get us over 1/3 of the way towards our 2030 Paris Agreement targets. And right now, there's nowhere close to 1/3 of global climate investments being made in nature-based solutions for climate change. And so given that health is such a powerful message, I feel like if health professionals get behind this message of conservation and nature-based solutions for climate change, that could go a long way towards closing that funding gap. So just briefly, in terms of the attention that our initiative has gotten, the World Health Organization, we were so proud when they featured us in their COP26 special report on climate change and health as one of only 2 case studies from North America, and basically as a way to inspire protection and restoration of nature for our health. So we were only one of 2 cited in the entire report, and grateful for that kind of global recognition. So if you wanted, check out our website, it's at parkprescriptions.ca. If you are a licensed regulated healthcare professional, you can feel free to register for our program. We have over 4,500 health professionals registered across the country right now to prescribe nature, which I think is absolutely incredible. And it's really grown over the past month in particular. So when you register, we'll send you a toolkit on how to prescribe nature and also a customized nature prescription file, which you can see on the left-hand side here. And you can start, dialoguing with your patients with a real kind of patient-centered approach to determine how they can incorporate nature into their lives, into their everyday lives to improve their health. We also have 14 different fact sheets broken down into adult and pediatric health, with lots of up-to-date studies on how nature is good for certain conditions. So feel free to take a look at our prescribers page on our website to access those resources. And so above and beyond the World Health Organization's recognition, we announced about a month ago now that we have a new partnering agreement with PaRx Canada, where healthcare professionals in our program can now prescribe discovery passes, annual discovery passes to PaRx Canada that give them admission to over 80 different PaRx Canada administered sites across the country for free for the next year, again, to give them something concrete to reduce barriers to nature access. So that was a really exciting announcement that's resulted in this kind of flood of media attention from around the world. So if you keep your eye out for stories about that, you might happen across some of them. And that's it for my part of the presentation. I'm going to hand it over to Angie.
Hi there, can you hear me? Hi, so I'm a medical student from University of Manitoba, and I've been really lucky to help Melissa launch PaRx in Manitoba. And I'm just gonna share my screen if I can. Slideshow, okay. And I'm just here to provide a little bit of a pediatric perspective. You know, we are at a conference about child health and the environment. And so I'm a medical student, my 4th year of medicine at the University of Manitoba, which is here on Treaty 1 territory in the homeland of the Métis Nation. And I'm interested in pediatrics, currently in the middle of my CARM cycle for applying to residency. So I did want to share and add on a few pieces of information that are specific to pediatrics. So we do live in a very sedentary society, and this has increased in the past 2 years with the COVID-19 pandemic. Kids are spending most of their day inside when it was Zoom school, and it was really hard for parents to keep kids entertained and focused on something. And I found that listening to patients and their families, they were telling me, oh yeah, the kids were on the iPad for several hours a day, more than they wanted to. So that's where nature can help. Spending time in nature can help you stay active. There was a systematic review of I think hundreds of studies between 1970 and 2015 that showed that children who spend more time in nature are more physically active and less sedentary. So that's especially if the green space that they're involved in is more diverse. So if there's landscaping around their house, or their childcare centers and schools, there's greenways and parks, and especially kind of rough ground for creative play, as opposed to more structured structures like the one in this picture. So nature play helps develop children's motor skills as well, and helps with balance and coordination. And there was one study in 2004 that compared motor skill development when playing in nature as compared to a traditional structure, and they found that it improved, nature time improved motor skills better than a wooden structure. So this is a picture of Lake Manitoba, and we've got a traditional play structure here, but we also have some nature, so it's a little bit of a combination. So another study that was focusing more on young adults and youth was a 2022 Norwegian study about nature-based services for young adults with mental health issues. The participants in this study had dropped out of school or had stopped working due to struggles with mental health. And they took part in nature-based services that were on farms or were working with animals or plants. And the experiences were group activities. This study found that the group activity helped the participants feel a sense of inclusion, affiliation, and social support. The results of this study were pretty similar to a 2012 study in Perspectives on Public Health that demonstrated that group walks in a park and group walks in the countryside helps children improve their self-esteem. I think it's really interesting that in this Norwegian study, 50% of the participants felt that they received the same amount of social support from the animals as they did from humans. Participants in this study also reported that outdoor activities provided them some time for self-reflection. So a lot of what Dr. Lem was saying, like you feel calm, you have time to self-reflect, you're not focusing on like every single thing, you're just taking time to kind of meditate. Although there wasn't a causal relationship demonstrated in this study, all the participants in the study agreed that nature-based intervention improved their mental and their physical strength. This is a picture of Clear Lake, one of my favorite places in Manitoba, also part of Riding Mountain National Park, one of the new places that you can prescribe a park pass to for your patients. So why prescribe nature to kids specifically? Some of these points have already been mentioned, but we do know that youth who spend more time in nature are more resilient and experience less anxiety and depression. A 2019 study of over 900,000 people showed that children who grew up around green space had lower risk of developing psychiatric illness as adults. And as Dr. Lem mentioned, children who have more nature experiences are more likely to become adult environmentalists. And I can attest to that because I spent a lot of time at Clear Lake as a young person, and it really got me involved in protecting nature. When we talk about prescribing nature to kids, we recommend, when prescribing it, let's say to a parent, we say follow your child's lead, focus on the fun, and plan green time around your child's interests, and that'll help grow a lifelong nature habit. So thank you so much for listening to us both. Mine was just a little mini add-on to what Dr. Lem was saying, but we'd love to take any of your questions if you have any. Thank you so much.
Thank you, Angie. Thank you, Dr. Melissa. So, do you have a question? Avez-vous des questions? N'hésitez pas à les poser.
I see Tim LeBlanc Murphy has one.
Yeah, sure. I definitely saw the news about the BC providing the PaRx pass, and that was awesome. I'm wondering, like, if you were in the know about that, like whether there's discussion about, like, I guess subsidizing or helping people get to the parks, because I think sometimes that's kind of the problem as well, is maybe less so the park entrance, but like if you don't have a car, if you're lower income, you might not even be able to get to nature, get outside the city and get to nature. Has that been part of the discussion in BC or elsewhere?
Yeah, absolutely. That's something, Tim, that often comes up when we're talking with different community groups about their barriers to access to nature, is transportation for sure. If you think about here in Vancouver, Surrey has one of the lowest concentrations of green space in town, and they're also, further away from our provincial parks, than other places in the Lower Mainland. So yeah, definitely. So one thing the BC Parks Foundation has done, and was doing more before the pandemic, was actually bringing groups of people out in school buses. So these would be groups like New Canadians, refugees, Chinese elders, like at-risk youth with mental health conditions, in buses kind of regularly to different provincial parks so they could experience nature. Of course, that's not as good as actually giving them access to nature in their, every week, or every day, but it is something that we've been trying to do. And then a longer term goal that we have also is we're trying to figure out the model, but actually give people discounts or even possibly free kind of transit passes to get to parks. So like, again, to reduce barriers to access because of that transportation issue. So it's something that we're definitely thinking about and are planning to approach different transit agencies about. But it's hard. It's a difficult question for sure, because yeah, often groups of people who need nature the most have the least access to it. It's kind of like a vicious cycle. But yeah, that's definitely on our radar.
Apparently my volume was quite low during the presentation, so I apologize for that. If there's anything that you couldn't quite hear, want me to go over again, I can do that.
Y a-t-il d'autres questions?
Just a little update if you're curious about if park prescriptions might be coming to New Brunswick anytime soon. It is, so keep an eye out. We have amazing active teams, including medical students like Angie, who are working on launching park prescriptions in Atlantic, Canada. So it's coming soon. Keep an eye out. This spring. Oh, I see Serge has her hand up.
Yeah, thanks, Melissa. That's great news about the pass coming to New Brunswick for sure. I really like the fact that you've made that link to conservation of natural spaces. Have you had conversations with folks like Nature Conservancy of Canada? There's many others, just about integrating these health benefits into support for their conservation measures.
Do you know what's really interesting is the very first time, like in a kind of a large public setting, that I talked about nature and health was actually at an annual Nature Talks event in Vancouver at Science Worlds that the Nature Conservancy of Canada had organized. And I was just telling this to someone the other day. I remember when I announced that the BC Parks Foundation was going to imminently launch a nature prescription initiative, a national nature prescription initiative, the crowd burst into this spontaneous round of applause. And I was shocked, like, whoa, you know, like we haven't even launched yet and they're already kind of giving us a round of applause for something we haven't done yet. So I think that really speaks to how much enthusiasm there is within the conservation sector for this idea of health coming on and working with conservation organizations. So yeah, absolutely. Something that the BC Parks Foundation actually does is they've run these amazing crowdfunding campaigns to raise money to preserve key parcels of land for you know, a variety of different things for ecosystem health and human health as well. And they have partnered with the Nature Conservancy of Canada and other groups to help make that happen. So for sure, it's yeah, we're happy to partner with nature-based organizations, definitely. But I think in terms of this organization, like Park Prescriptions in particular, we have a big focus on actually the health sector, because that's kind of an area that hasn't been traditionally involved and engaged in the environmental sector. So that's what we're trying to do, is spread the word to health professionals.
Une dernière question? D'autres questions?
I just want to mention too that Angie has a residency interview right after this presentation. So thank you so much to her for making the time to do this in a really stressful time. It's wonderful. So everyone send her
Thank
goodbyes.
you. Thank you so much. And I might have to leave now, but I really appreciate the invitation, and I'll try to check out the rest of the conference.
Thank you, Angie. Bye.